Hey everybody, it's Sarah back after a long break. This is week 19 post-op for me. My surgery went off without a hitch in September. That was the 23rd, 2010. My starting weight was 240. Um, no problems really with surgery, typical pain, soreness, all that kind of stuff afterwards for about a week and a half or so. But no complications, uh, no trouble at all, and great support from my doctor's office. So that was really awesome. Here I am in week 19, and after a very slow start, finally I'm getting some restriction, and I've now lost about 25 pounds. Yay! So I'm happy about that. Um, I've got about 50 more to go, and I'm feeling pretty good about it. So Um, my weight loss has been really slow, considering that I'm about 4 months out. 25 pounds may not sound like a whole lot. Um, first, um, I really didn't have very much restriction at all once I got off the liquid diet. And so the fills were really gradual as well. My doctor starts people off with a 2 cc fill. I have a 10 cc band. Um, 2 cc fill at 9 weeks post-op, and then every 3 to 4 weeks after that, another half cc to 3/4 cc at the most. So my first fill was 2 cc's, my second was 3/4, and then I've had another 3 fills after that at a half cc each. And only just now, these past 2 fills, have I really seen difference. Um, Major difference, and some restriction in what I'm eating, and my sensation of fullness is really getting up there. So that's been huge. I feel like I finally have a lap band. At first, I really didn't feel like I had one because I was able to eat pretty much whatever. Um, as far as capacity wise, obviously I was free to make good choices, which I didn't always do, but um, as the restriction wise, it just wasn't there. So now I've got it. I feel like I'm rolling, so that's really good. Um, Another frustrating point for me has been that my scale at home seems to be insane and possibly possessed by a demon. Not sure about that, but it seems to like to tell me a low weight, and I always weigh in the morning. First thing in the morning, get up, go to the bathroom, get on the scale before I get dressed or anything like that. It tells me a good weight, and then if I bump the scale or nudge it 6 inches or something like that, get on again, it tells me like a pound, 2 pounds more. It's insane. And it makes me so crazy because I get all excited, like, oh, look at that, I lost so much weight. And then I get on it again, to confirm because I know the scale is crazy, and it tells me something completely different. So that's been making me pull my hair out. If you have any suggestions, recommended brands of scales that you find are really reliable for at home, I don't want to spend $100 preferably, but if you do have a recommendation, I would love to hear about it. Um, Hair, I mentioned I feel like pulling my hair out over the scale. I also have been noticing some hair situation. I feel like I'm shedding hair. I don't know that I'm losing my hair. I mean, I'm not bald or anything like that, but I do feel like there's a vitamin issue going on there. So, upgrading my vitamins. I'm going to try some bariatric vitamins by Celebrate, specifically for lap band patients. So, hopefully that will help. I'll let you know. Um, Last thing I want to say is I learned something interesting the other day that apparently many lap band patients wear a medical bracelet or ID of some kind, or like on the wrist or a necklace or something like that, because of the risk of if you get you know, if you're unconscious or in an accident or something like that, and medic, EMT, doctor, whatever decides they have to intubate you through the nasal passage, um, NG tube or whatever, if they do it blind, meaning without a scope or an X-ray at the same time, they can actually perforate stomach of a lap band patient without knowing, because they don't realize that you have a lap band and they don't realize the risk involved in doing an NG tube. So a lot of people wear a bracelet that say lap band, no blind NG tube, and like no NSAIDs or stuff like that. So I ordered one. Do you have one? Do you wear one? Do you think it's necessary? Do you think it's paranoid? Tell me. I'd like to hear about it. That's it for now. I'll post again in about a week. That'll be week 20. Let you know how things are going, okay? Thanks. Bye.